What if I told you that 95% of nursing students get the same types of NCLEX questions wrong? And what if I told you that by the end of this video, you'll know exactly how to get them right? Today, I'm exposing the top 10 question types that cause the most failures on the NCLEX. And more importantly, I'm giving you the exact framework to master them. Hey, future nurses! After analyzing over 50,000 NCLEX practice questions and helping thousands of students pass their boards, I've identified the exact patterns that trip up even the smartest nursing students. These aren't just difficult questions. These are trick questions that the NCLEX uses to test if you can think like a nurse, not just memorize like a student. In the next 20 minutes, you'll learn why prioritization questions destroy test scores, the delegation mistakes that fail 70% of students, how to spot and avoid the infamous distractor answers, the therapeutic communication traps everyone falls for, and the number one medication question that appears on every NCLEX. Grab your notebook, because this information literally determines whether you'll be signing RN after your name or retaking this $200 exam. Quick question before we dive in. Comment below. What type of NCLEX question scares you the most? Priority? Meds? Delegation? Let me know, and I'll make sure to address it. And if you're serious about passing the NCLEX, hit that subscribe button and ring the bell. I drop new NCLEX strategies every week that you won't find in any review book. All right, let's start with the number one question type that students get wrong. And honestly, it's the one that makes or breaks your NCLEX score. Mistake number one: priority questions with multiple critical patients. Here's a classic example that 89% of students get wrong. The nurse has just received report on 4 patients. Which patient should the nurse see first? A. A post-op patient day 1 with a temperature of 100.4 degrees Fahrenheit. B. A diabetic patient with blood glucose of 250. C. A patient with COPD with oxygen saturation of 91%. D. A patient with chest pain rated 3 out of 10 after receiving morphine 30 minutes ago. Most students pick A because fever means infection. But here's what they're missing. The correct answer is D. Why? Because chest pain, even when improving, could indicate an evolving MI. The key is the timeline. 30 minutes ago means we need to reassess effectiveness and ensure no cardiac event is occurring. Here's your priority framework. 1. Acute over chronic. Chest pain, even mild, is acute. 2. Unexpected over expected. A temp of 100.4 on day 1 post-op is expected. 3. Unstable over stable. A COPD patient with 91% oxygen sat is their baseline. 4. Fresh symptoms over established. Recent morphine needs evaluation. Remember, the NCLEX wants to know if you can identify who might die first, not who needs care first. Let's apply this. Another question: which patient should the nurse assess first? A. Patient with pneumonia coughing up yellow sputum. B. Patient 2 hours post-cardiac catheterization with bleeding at insertion site. C. Patient with acute pancreatitis reporting pain 8 out of 10. D. Patient with DVT on heparin with PTT of 70 seconds. Pause the video and think. The answer is B. Post-cath bleeding can indicate arterial bleeding, life-threatening in minutes. Yellow sputum is expected with pneumonia, pancreatitis pain is expected, and PTT of 70 is therapeutic range for heparin. Mistake number 2. Delegation questions. The LPN and UAP trap. Delegation questions destroy students because in clinical, you've seen LPNs and CNAs do everything. But the NCLEX lives in legal land, not real-world land. Here's the killer question. The RN is caring for 4 patients. Which task can be delegated to the LPN? A. Administering IV push morphine. B. Initial assessment of patient with chest pain. C. Teaching insulin administration to newly diagnosed diabetic. D. Administering oral medications to stable patients. 63% pick B because LPNs assess patients all the time in real life. The answer is D. Here's your delegation matrix that will save your NCLEX life. RN only. Initial assessments, not ongoing. Teaching, meaning formal education. IV push medications. Unstable patients. Care planning. LPN can do. Ongoing assessments, not initial. Reinforcing teaching, not initial. Oral, IM, and sub-Q meds. Stable patients, routine procedures. UAP and CNA can do. Vital signs on stable patients. ADLs like bathing and feeding stable patients. Ambulation. I and O documentation. Positioning. The magic phrase. When in doubt, don't delegate out. Here's the NCLEX secret. If the question says which task is most appropriate to delegate, they're all legal to delegate, but you pick the lowest skill level. But if it says which can be delegated, only one is legally correct. Mistake number 3. The first action versus best action confusion. This is subtle but deadly. Watch. A patient reports sudden onset of shortness of breath and chest pain. What is the nurse's first action? A. Administer oxygen. B. Call the physician. C. Obtain vital signs. D. Raise the head of the bed. Then another question. A patient reports sudden onset of shortness of breath and chest pain. What is the nurse's best action? A. Administer oxygen. B. Call the physician. C. Obtain vital signs. D. Raise the head of the bed. Different answers. First action equals D. Raise the head of the bed. Immediate, no equipment needed. Best action equals A. Oxygen. Most therapeutic overall. Here's your framework. First means fastest. What takes 1 second? Initial means assessment. What do I need to know? Priority means most life-saving. What prevents death? Best means most therapeutic overall. What helps most? The NCLEX is testing if you understand the sequence of nursing care, not just the components. Mistake number 4. Medication math errors. The decimal disaster. The physician orders digoxin 0.125 milligrams PO daily. Available is digoxin 0.25 milligram tablets. How many tablets should the nurse administer? Seems easy, right? But 41% of students get this wrong under pressure. They either forget to convert units, move decimals the wrong direction, or round incorrectly. Answer: 0.5 tablets, half a tablet. Here's your foolproof method. Desired over have times quantity. 0.125 milligrams divided by 0.25 milligrams times 1 tablet equals 0.5 tablets. Always ask, does this make sense? I need less than what I have because 0.125 is less than 0.25, so I give less than 1 tablet. Check. Rounding rules for NCLEX. Tablets, round to nearest half. Liquids, round to nearest tenth. IV rates, round to whole number. Pediatric, never round. Always exact. Mistake number 5. Therapeutic communication. The feeling trap. A patient says, "I'm going to die during surgery tomorrow. I just know it." What is the nurse's best response? A. Don't worry, your surgeon is excellent. B. Tell me more about your concerns. C. Many people feel this way before surgery. D. The mortality rate for this procedure is less than 1%. Answer is B. But here's why students miss this. Therapeutic responses that NCLEX loves. Open-ended like, tell me more. Reflecting like you sound worried about. Clarifying like, help me understand. And silence. Yes, silence is therapeutic. Non-therapeutic responses that NCLEX hates. False reassurance like, don't worry. Minimizing like everyone feels that way. Changing the subject. Giving advice like you should. And why questions? Because they make patients defensive. The golden rule. If the answer makes the patient talk more, it's correct. If it makes them stop talking, it's wrong. Mistake number 6. Lab values. The panic versus normal trap. Which lab value requires immediate intervention? A. Potassium 3.4. B. Sodium 134. C. Glucose 250. D. Calcium 8.8. Students panic and pick C because 250 is so high. But the answer is A. Why? Because potassium affects the heart. Here's your hierarchy. Panic values that are life-threatening now. Potassium below 3.5 or above 5.5 means cardiac arrest. Sodium below 120 or above 160 means seizures. Glucose below 40 means brain death. Calcium below 7 or above 12 means tetany or cardiac arrest. Critical but not immediate. Glucose 250 is concerning but not immediately fatal. Hemoglobin below 7 needs transfusion, but patient is not coding. Platelets below 20,000 is a bleeding risk, but not active bleeding. Remember, cardiac killers first. Potassium, calcium, magnesium. Mistake number 7. Infection control. The isolation confusion. The nurse is caring for patients with various infections. Which patient requires droplet precautions? A. Patient with tuberculosis. B. Patient with influenza. C. Patient with MRSA wound infection. D. Patient with Clostridium difficile. This gets missed because students memorize randomly instead of understanding the why. Answer is B. Here's your isolation memory system. Airborne requiring an N95 mask. Remember MTV. Measles, tuberculosis, varicella, which is chickenpox. Droplet requiring a surgical mask. Remember Spider-Man. Sepsis and scarlet fever, pneumonia, influenza, diphtheria, epiglottitis, rubella, meningitis, adenovirus, and pertussis, which is whooping cough. Contact requiring gown and gloves. Anything with pus, poop, or parasites. MRSA, VRE, C. diff, wounds, pressure ulcers, scabies, and lice. The trick. Think about how it spreads, not what the disease is. Mistake number 8. Pediatric questions. The adult thinking error. A 3-year-old is scheduled for surgery. What's the best way to prepare them? A. Explain the procedure 1 week in advance. B. Use dolls to demonstrate the procedure the day before. C. Have parents explain everything. D. Wait until immediately before to reduce anxiety. Answer is B. Students pick A, thinking more time equals better. But that's adult thinking. Age-specific preparation. Infants, prepare parents and use comfort measures. Toddlers ages 1 to 3, simple explanations immediately before. Preschool ages 3 to 6, day before with play therapy. School age 6 to 12, 1 to 2 days with demonstrations. Adolescents, 1 week or more with full explanations. Remember, the younger the child, the shorter the time frame. Preschoolers can't understand next week. They need concrete, close timing. Mistake number 9. Positioning questions. The gravity game. Following a liver biopsy, how should the nurse position the patient? A. Left side lying. B. Right side lying. C. Supine with head of bed elevated. D. Prone. See, these questions kill students because they memorize positions without understanding the physiology. Answer is B. The liver is on the right, so right side lying puts pressure on the puncture site. Master formula. Post-procedure, lie on the operative side because pressure stops bleeding. Respiratory distress, high Fowler's because gravity helps breathing. Increased ICP, head of bed at 30 degrees to promote drainage and prevent increased pressure. Shock, flat with legs elevated to get blood to vital organs. Pregnant, left side lying to prevent vena cava compression. Think, What does gravity do to help or hurt this patient? Mistake number 10. The select all that apply nightmare. Select all interventions for a patient with heart failure. Daily weights. Restrict fluids. High sodium diet. Monitor I and O. Elevate legs. Oxygen as needed. Students either pick too many or too few because they overthink. Correct answers are daily weights, restrict fluids, monitor I and O, and oxygen is needed. SATA Success Strategy. 1. Treat each option as true or false. 2. Don't look for patterns because it could be all or none. 3. Trust your first instinct. 4. Think would I do this independently? For heart failure specifically, yes to anything reducing fluid like weights, restriction, and monitoring. No to high sodium because it retains fluid. Maybe to elevate legs because it can increase preload depending on severity. Pro tip: in SATA, usually 2 to 4 answers are correct. If you have 0 to 1 or 5 to 6, double check. Let's recap the 10 deadly NCLEX mistakes. 1. Priority. Remember acute over chronic. 2. Delegation. RN assesses and teaches. 3. First versus best. First is fastest. 4. Med math. Always ask, does this make sense? 5. Communication. Make them talk more. 6. Labs. Cardiac killers first. 7. Isolation. Think transmission method. 8. Pediatrics. Younger means shorter time frame. 9. Positioning. What does gravity do? 10. SATA. Each option is true or false. Your homework. Take 10 practice questions today, focusing on these areas. Screenshot your wrong answers and analyze why using these frameworks. Drop a muscle emoji in the comments if you're committed to passing the NCLEX on your first try. Remember, the NCLEX isn't testing if you can memorize. It's testing if you can think like a nurse. These frameworks are your thinking tools. If this video helped you, please share it with your study group. Let's help everyone pass. Subscribe for weekly NCLEX strategies, and I'll see you in the next video where we'll tackle the hardest pharmacology questions. Until then, keep studying smart, not just hard. You've got this, future nurse.